Today we are going to talk about retinoblastoma. Retinoblastoma is the commonest intraocular malignancy in child, and this origin is, they say, it is hereditary or autosomal dominant, which is more than 90% in this category, and the balance is sporadic. Now, in this tumor is originate between the 18 months and 24 months of age of a child, and this is bilateral in occurrence also. In case of bilaterality, the age of origin is less than 18 to 24 months, and there is no male-female preponderance in this condition. Now, what is the presentation? Presentation of this retinoblastoma is 20% of the cases are presented like strabismus, laci, or squint. Two-thirds of the cases are presented with white reflex or cat's eye or leukocoria. And by doing the slit lamp examination, we can see AC cells or pseudohyperpian, hyphema, enlarged eyes, ophthalmos-like appearance, or infantile glaucoma. So these are the common presentation of this uh, retinoblastoma. And this retinoblastoma is a highly malignant tumor in children, and pathologically this is diagnosed by several types of staining. Flexavitazine staining is done, and home rights staining also. Flexavitazine staining is seen in the mild forms, and the home rights are seen in the severe forms of the condition. And this retinoblastoma development is described by certain theories like nuts and two hit theory. What is that nuts and two hits theory? That means there are two suppressor recessive genes are there. As long as these two suppressor recessive genes are there, there's no chance of developing retinoblastoma in that particular eye. So, due to some reason, say due to hereditary or genetical mutation, one suppressor recessive gene is deleted. Then that particular eye is more prone to develop sarcomas in that particular eye. Due to some reason, the second suppressor recessive gene also deleted due to some external conditions like radiation and all that. So ultimately, both these suppressor recessive genes also deleted. So now this particular is more prone to develop retinoblastoma. Now, how are you going to approach this condition? This condition can be approached medically as well as surgically, according to the indications. Sometimes the patient's eye has to be removed, enucleation, or with excineration, or medically also can be treated with some drugs like vincristine and melphalan and all that. Now there's a condition called trilaterality in this condition, retinoblastoma. That means both eyes are affected by retinoblastoma, and the third tumor is in the pineal gland. So that means this is what you call a trilaterality of retinoblastoma. But in this pineal gland tumors is the primary one, not the secondary deposit from the retinoblastoma of the affected patient. Now there are grading and staging also in this condition. What is grading and staging means? Grade 1, 2, 3, 4, in that category we categorize this tumor. Grade 1 is differentiated. Grade 2 is undifferentiated. Grade 3 is highly undifferentiated. And grade 4 is anaplastic. So grade 1 is good prognostic one when you compare to grade 4. A staging is actually done to assess the severity. Stage 1 is compared to stage 4 is less severe in nature.